Okay, thank you for coming today. It's great to see all of you here. This is the Substance Abuse Education Group here at Dayspring Village at the Phoenix program, dealing with the subject of alcohol and schizophrenia. So we're going to chat a little bit about alcohol and schizophrenia. Hopefully you'll learn a few things you didn't know about, and we'll have time for discussion at the end of the group with the group leader. And I want you to kind of have an opportunity to talk a little bit about the subject. So let's make no mistake about it. Alcohol is a very powerful drug. The impact of alcohol on recovery cannot be underestimated. And alcohol, while legal in the United States, is not safe for adults with schizophrenia. Always understand the threats that impact your recovery, because that's what will determine whether you spend time in the hospital, time in the jail, time in a homeless shelter, in all these other circumstances. So it's very important to protect your recovery and protect the hard work that you put in to helping you become stable and moving towards recovery. So let's talk a little bit about how alcohol works. It activates the GABA and serotonin receptors. It then inhibits glutamate receptors, and of course, GABA receptors are inhibitory, and alcohol has a sedating effect. And so alcohol is metabolized through alcohol dehydrogenase pathway. And that's very important to know, because this has an effect on how alcohol is metabolized through the body and how the body handles the process of dealing with alcohol. So one of the interesting things that you may not know about is people of Asian descent have less aldehyde hydrogenase and therefore can become more quickly intoxicated. They can have facial flushing and nausea, and so definitely alcohol use, if you have Asian parents or Asian descent, can be very harmful, and its effects can take hold very quickly. So when we're screening tests for alcohol use disorder, and that's something that happens quite a bit, there is what's called the MASS test. This is the Michigan Alcoholism Screening Test. There is the audit test, the Alcohol Use Disorder Identification Test, and then the CAGE questionnaire, which is easy to administer, and we'll talk a little bit more about that later. But it's always important that there's always an assessment, an evaluation, to make sure that in fact there is an alcohol use disorder. So it has to meet certain criteria. So it is always important to make sure that there are good clinical tools being used to help establish diagnosis, because from the assessment comes the diagnosis, and from the diagnosis comes the plan of care. So the CAGE questionnaire, let's talk about that for a minute. There's some basic questions. So have you ever wanted to cut down on drinking? Have you ever been angry or annoyed when people criticize your drinking? Have you ever felt guilty about drinking? And have you ever needed a drink first thing in the morning? These are all indicators that there might be an alcohol use disorder, and certainly worth paying attention to. And these are easy questions. It's called the CAGE questionnaire, and we'll come back and talk a little bit about that later during our question and answer session. So let's talk a little bit about alcohol intoxication. What factors affect absorption rates, and do they depend on? Well, for sure, age, sex and gender, weight, how quickly you drink alcohol, all these affect how quickly you metabolize alcohol through the body. And that becomes very important as it relates to alcohol intoxication, which can have a lot of negative effects on your mental health recovery. So I'm asked often, are there other factors that affect absorption rates? And absolutely there is. So the presence of food in the stomach, your general state of nutrition, how well you're eating, chronic alcoholism, or if you've had a history of chronic alcoholism, can have an effect. Then, of course, there is cirrhosis of the liver or damage to the liver. All of these affect the rate at which alcohol is being absorbed in the body. So this is all really important to know as you are dealing with these factors, or you have friends or peers in your immediate circle that may have or should have problems with these issues. So let's talk a little bit about blood levels of alcohol and behavior. So at 0.05, then what we see is thought and judgment impairment. So there is definitely an immediate impact that alcohol has. At 0.1, clumsiness and legal intoxication start to arise, and you start to have problems there. Depression of motor skills, such as gait is wobbly and you're having trouble standing up straight or walking in a straight line, that normally occurs at a 0.2% level of consumption. Confusion and stupor is at 0.3, and coma and death can occur from 0.4 to 0.5% alcohol level in your blood. So we're back to diagnostic evaluation. Again, it's always important to remember that diagnosis is based upon assessment, upon facts, and we have to have certain facts to establish the diagnosis. So you're going to want to look at a serum ethanol level. Also, you want to make sure you do a CT head scan to rule out subdermal hematoma or brain injury, because a lot of people with alcohol problems have problems with falling down, hitting their head, or have had other types of impact to their head that would indicate that maybe we need to have a closer look at a CT scan to make sure we're ruling that kind of problem out. So here's a few things when treating an acute alcohol-related disorder that you're going to see happen in the emergency room typically, but also with your mental health provider. So they may want to ensure that your airway, breathing, and circulation are doing fine. Perhaps they're going to do a finger stick and look at your blood glucose level. The administration of thiamine naloxone is also something that possibly will happen. So in terms of recovery, AA groups have proven to be probably the most effective in terms of trying to prevent further reoccurrences, and then also smart recovery. That's a new kind of group therapy. Antabuse therapy is a medication that's prescribed where the individual who's drinking while on antabuse will have a terrible reaction to it, and naltrexone reduces the pleasure of drinking. So this is another medication approach to help manage chronic alcohol or drinking related problems. Also, psychotherapy and working with your individual therapist becomes another pathway towards recovery. So let's talk a little bit about alcohol withdrawal and what to look for, pay attention to. So we're going to be looking for irritability, insomnia, fever, possible disorientation or delirium, seizures, and possibly hallucinations. All these will be factors that show up when somebody who has been drinking continuously or on a consistent basis and starts to stop drinking. So probably the most serious withdrawals is called delirium tremens, DTs as often as it's called. This usually begins within 72 hours of cessation of drinking. Visual and tactile hallucinations can occur, severe tremors in the hands and arms, and you will likely see an instability in vital signs. So vital signs will start to go all over the place. So we'll generally want to check vital signs, a head CT scan as we talked about before, looking for possible trauma. And then there is a clinical institute withdrawal assessment from alcohol test that can be done, and that's called the CWA, and certainly that is something that can be done by the treatment professional. So typically the treatment of DTs is going to happen with tapering doses of benzodiazepines, the use of thiamine, folate, multivitamin, and then magnesium sulfate for post-withdrawal seizures. These are all options that are going to be used to treat DTs in a person who has discontinued drinking alcohol and has a chronic history of alcoholism. So in the United States, there's about 2.2 million people living with schizophrenia. Right here in Florida, there's about 55,000 adults with schizophrenia who receive SSI. It's estimated 50% or up to 50% of patients with schizophrenia also have drug and alcohol dependence issues, and then more than 70% are nicotine dependent. Odds of having substance abuse diagnosis with schizophrenia is almost 5 times as greater than the general population. So what we know is people with schizophrenia, alcoholism and alcohol use or substance abuse use becomes a very high risk category that affects recovery and affects your ability to successfully manage your symptoms and move on with important things in your life. So, without question, the impact of alcohol and schizophrenia can be absolutely devastating to recovery. Mixing alcohol and antipsychotic medication can be very dangerous. Symptoms will absolutely worsen rapidly. Alcohol will tend to break up the medication, reduce plasma levels below therapeutic levels, and it's a violation of your conditional plan of release to use alcohol while enrolled at the Phoenix program here at Dayspring Village in Hilliard. So now's the time for questions and answers and give you an opportunity to talk. So the group leader is going to go around the room and ask each of you to participate and ask for each of you to any kind of questions that you may have that we need to follow up on. Or if there's been a history of alcoholism in your family, now's a good time to have a chat about that, or at least have a conversation about it. And also strategies that you may be using to help prevent the alcohol use in your immediate environment. So when friends or others in your immediate environment talk about using alcohol, how do you handle that? What do you do? And so it's very, very important that you have a plan in order to keep yourself safe, protect your recovery, because you've worked very, very hard to get to the place that you're at today. We want to make sure that you continue to make progress in your recovery plan. We want to continue to see you make progress in managing your symptoms effectively. And part of that, and a lot of that, depends on how well you're managing your environment and those things that threaten your recovery. So we want to make sure that you have an opportunity to chat about that with the group leader this afternoon. We thank you so much for attending and participating. It's so exciting to have all of you here today, and we'll look forward to the discussion time that will begin at the end of this presentation. Thanks a lot, and look forward to seeing you on campus. Bye now.